I feel very fortunate to work for a Catholic ministry. I feel that the mission and values are aligned very similarly with my own. The core principles of the Catholic ministry include providing and defending human dignity, so that's treating all patients with respect. Also, providing adequate health care for all persons, so the poor, the uninsured, the underinsured, and also caring for the physical, psychological, social, and spiritual dimensions of everyone. So that's caring for the whole person, mind, body, and spirit, not just the physical ailments that may have a person in contact with us or in the hospital. As far as providing Becca, this new mom, with pain management teaching, I think that one of the most important key concepts is just to address why narcotics wouldn't be indicated in management of postpartum pain. I think that it's important to educate this new mom, especially someone who may have a history of prior substance use or abuse, about the effects to the mom and then also to the baby. So just letting the mom know that these medications come with a risk for dependence. They can cause negative effects like sedation, which may impair her ability to care for the new baby. They can also cause constipation, stressing that there's the risk that these medications can be transferred through breast milk. So if she's breastfeeding, there's the potential that the baby could then be exposed to the medications, and the risk for just over sedation or sedation in the baby, and the things that can go along with that. I would stress that we would recommend using ibuprofen and Tylenol, which are both safe for mom and baby. The patient mentioned that the ibuprofen upset her stomach, so I would just provide teaching to the mom and just let her know that she could take the medication with water, with food, to try to help with the stomach upset that could come along with NSAIDs. Also recommending that she take the medication with some type of antacid to help also with the stomach upset. Just providing additional education and ways for her to manage some of the side effects that may come along with this medication and be able to avoid narcotics. I think it's also important to teach the mom about what's normal and what's to be expected postpartum. So to figure out exactly what's hurting and the quality and severity, and just asking more questions. You know, in a postpartum patient, it would be normal to experience breast discomfort, also uterine contractions, perineal discomfort from any trauma or lacerations experienced during a vaginal birth, or of course, incisional pain from a C-section. So I think it's important to just talk to the mom and figure out exactly, where she's experiencing the pain, and then also go over pharmacological ways to address the pain, but then also non-pharmacological. So if the mom is saying that, she's having breast issues, just making sure that if she's breastfeeding, so, baby's latching properly, go over use of cold compresses in addition to the medication, just, NSAIDs, Tylenol that she could be taking to help with some of the discomfort. If she's having uterine contractions, using a heating pad to help with some of that discomfort. If she's having perineal pain, go over using, again, the cold packs for up to 3 days postpartum, in addition to the medication. So I think that just sitting down and talking to the mom a little bit more about the site, the location that she's experiencing pain, letting her know that these are all normal, to be expected, and kind of researching and investigating a little bit more, and then going over things that she can do in addition to pharmacological treatment, and just stressing the avoidance of using any narcotic pain for this mom who is newly postpartum.